The patient's plight is a familiar struggle. Sinus issues plague countless individuals, causing discomfort and disrupting daily life. The persistent stuffiness, facial pressure, and throbbing headaches can make even the simplest tasks feel insurmountable. Whether it's a seasonal allergy or a chronic condition, sinus problems can significantly impact a person's well-being. Imagine waking up each morning with a dull ache in your forehead, your sinuses feeling like they're filled with lead. Simple pleasures like tasting food or smelling freshly brewed coffee become distant memories, overshadowed by the overwhelming discomfort. This is the reality for millions who suffer from sinus issues. Seeking relief. A visit to the doctor's office. Determined to find a solution to their persistent sinus woes, our patient decides to seek professional help. They schedule an appointment with a trusted doctor, hoping for answers and effective treatment options. Stepping into the doctor's office, the patient is greeted by a sense of calm and order. The waiting room, though filled with other patients seeking medical attention, exudes an air of quiet anticipation. The receptionist, with a warm smile and a reassuring demeanor, checks the patient in, putting them at ease. Leafing through a magazine, the patient's mind races with questions for the doctor.
Hello, I'm Dr. Smith. How can I help you today?
Hi, Dr. Smith. I've been having these terrible sinus issues for months now. It's really affecting my life.
I understand. Let's talk about what's been going on. Can you tell me more about your symptoms? How often do they occur, and have you noticed any specific triggers?
The doctor's genuine concern and willingness to listen create a safe space for the patient to open up about their experiences.
Sinus issues are quite common and affect millions of people. The good news is that there are effective treatments available. We'll work together to develop a personalized treatment plan tailored to your specific needs.
The doctor's calm and reassuring presence instills a sense of hope in the patient, who begins to believe that relief is within reach.
All right, let's take a look. I'll be examining your ears, nose, and throat to check for any signs of inflammation or infection. I'll also use a special instrument to illuminate your nasal passages for a closer look.
Throughout the examination, the doctor explains each step, ensuring the patient feels comfortable and informed.
So, doctor, what exactly is going on with my sinuses? Why do they seem to have a mind of their own?
Well, to understand sinus issues, we need to first understand what sinuses are and why we have them. Sinuses are air-filled spaces within the bones of the skull. They are located around the nose, cheeks, and forehead. These cavities serve several important functions. They help to lighten the weight of the skull, which is crucial for our balance and posture. They also act as resonance chambers, influencing the sound of our voice. Most importantly, sinuses produce mucus, a thin, watery fluid that helps to humidify and filter the air we breathe. This mucus traps dust, allergens, and other irritants, preventing them from reaching our lungs.
The patient, now understanding the vital role sinuses play, wonders what could disrupt their delicate balance.
Each sinus cavity is lined with a thin membrane called mucosa. This mucosa produces the mucus that keeps our sinuses healthy. The sinuses are connected to the nasal cavity through small openings called ostia. These openings allow for the drainage of mucus and the equalization of air pressure between the sinuses and the nasal passages.
So, if these openings become blocked, it could lead to sinus problems?
Precisely. When the ostia become inflamed or obstructed, mucus can become trapped within the sinuses, creating a breeding ground for bacteria and viruses. This blockage can lead to a buildup of pressure within the sinuses, causing the pain and discomfort associated with sinusitis.
The doctor senses the patient's curiosity and continues their explanation, pointing to the lining on the nasal cavity model. The patient examines the model, visualizing the delicate lining within their own sinuses, piecing together the information and beginning to understand the delicate balance within the sinuses.
But what causes these blockages in the first place?
There are several factors that can contribute to sinus problems. Allergies are a common culprit. When you have an allergic reaction, your body releases histamine, a chemical that triggers inflammation in the nasal passages and sinuses. This inflammation can lead to swelling of the mucosa, narrowing or blocking the ostia. Infections are another common cause of sinus problems. Viruses such as the common cold or bacteria can infect the sinuses, leading to inflammation and mucus buildup. In some cases, structural abnormalities within the nasal cavity can also contribute to sinus issues. A deviated septum, for example, can obstruct airflow and mucus drainage, increasing the risk of sinus infections.
The patient who has a history of seasonal allergies nods in understanding. Absorbing the vast array of potential causes, the patient feels a mix of curiosity and concern.
Now that we have a better understanding of what causes sinus issues, let's talk about what we can do to alleviate your discomfort. The good news is that many sinus problems can be managed with simple lifestyle changes.
Really?
Absolutely. While these changes may seem small, they can have a significant impact on your sinus health. We want to reduce inflammation, promote mucus drainage, and prevent the buildup of irritants.
The patient, eager for relief, leans forward attentively. Surprised that something so straightforward could make a difference, the patient visualizes their sinuses as a delicate ecosystem and nods in understanding. Realizing that lasting relief requires a proactive approach, the patient makes a mental note to commit to these lifestyle modifications.
I'll definitely make sure to stay hydrated. Well, when you're dehydrated, your body conserves water, and this includes the mucus in your sinuses. As a result, the mucus becomes thicker and stickier, making it harder for it to drain properly. When you're well hydrated, your mucus remains thin and watery, allowing it to flow freely and flush out irritants. Aim for at least 8 glasses of water a day, and even more if you're physically active or in a dry environment. But why is hydration so crucial for sinus health? One of the most important things you can do is stay hydrated.
In addition to staying hydrated, it's important to create a sinus-friendly environment.
What does that entail?
This means maintaining optimal humidity levels and minimizing exposure to irritants. Dry air can irritate the nasal passages and thicken mucus, exacerbating sinus problems. Using a humidifier can help add moisture to the air, keeping your sinuses hydrated.
That sounds helpful.
Just as important as adding moisture is avoiding irritants that can trigger inflammation and congestion. Common irritants include dust mites, pet dander, smoke, and strong perfumes.
I'll need to avoid those.
Take steps to minimize your exposure to these triggers. Regularly cleaning your home, washing bedding in hot water, and using air purifiers can help reduce allergens. While lifestyle changes are essential for managing sinus issues, sometimes we need a little extra help.
That makes sense, considering my symptoms haven't completely resolved.
They can provide relief from congestion, inflammation, and other sinus-related discomforts. That's where medications come in.
Which medications are most effective for sinus issues?
Each type of medication works in a different way to target specific symptoms, and understanding their mechanisms of action is key to using them safely and effectively. There are 2 main types of medications we often recommend for sinus problems: nasal sprays and decongestants.
I'll need to remember that.
Let's start with nasal sprays. These medications are designed to be sprayed directly into the nostrils, delivering targeted relief to the nasal passages and sinuses. There are 2 main types of nasal sprays we commonly recommend for sinus problems: saline sprays and corticosteroid sprays. Saline sprays are a gentler option that work by rinsing the nasal passages with a saltwater solution. This helps to thin the mucus, flush out irritants, and reduce inflammation. Corticosteroid nasal sprays, on the other hand, are more potent and work by reducing inflammation in the nasal passages and sinuses. These sprays are particularly effective for allergic rhinitis and other inflammatory conditions that contribute to sinus problems.
The patient, wondering if their allergies warrant corticosteroid spray, listens attentively as the doctor continues.
It's important to remember that medications should always be used under the guidance of a healthcare professional. They can help you determine the appropriate medication, dosage, and duration of treatment based on your individual needs and medical history.
I understand. I'll consult my healthcare provider.
The patient, relieved to hear about a gentle and effective option, makes a mental note to purchase saline spray.
Now let's talk about decongestants. These medications work by constricting blood vessels in the nasal passages, which reduces swelling and congestion. Decongestants are available in both oral and nasal spray forms. Oral decongestants, such as pseudoephedrine or phenylephrine, provide systemic relief, meaning they work throughout the body. Nasal decongestant sprays, such as oxymetazoline or xylometazoline, offer more targeted relief to the nasal passages. While decongestants can be highly effective in providing quick relief from congestion, it's important to use them with caution. Long-term use of nasal decongestants, particularly for more than 3 consecutive days, can lead to a condition called rebound congestion. Rebound congestion occurs when the nasal passages become dependent on decongestants to stay open. When you stop using the decongestant, these blood vessels can overcompensate by becoming even more dilated than they were before. This leads to a rebound effect, where the congestion returns with a vengeance, often worse than it was initially. That's why it's crucial to use decongestants only for short periods, typically no more than 3 consecutive days, and to follow the recommended dosage instructions carefully.
The patient, grateful for the doctor's thorough explanation, feels empowered to make informed decisions about their sinus health.
If your symptoms persist beyond 3 days, it's essential to consult with a healthcare professional to explore other treatment options.
The patient, understanding the importance of following medical advice, nods in agreement.
Long-term use of nasal decongestants, particularly for more than 3 consecutive days, can lead to a condition called rebound congestion.
The patient, imagining their nasal passages developing a dependence on medication, listens intently.
When you use decongestants for an extended period, the blood vessels in your nasal passages can become accustomed to the constricting effects of the medication. When you stop using the decongestant, these blood vessels can overcompensate by becoming even more dilated than they were before. This leads to a rebound effect, where the congestion returns with a vengeance, often worse than it was initially. In most cases, lifestyle changes and medications are sufficient to manage sinus issues effectively.
The patient, relieved to hear that surgery is not always necessary, nods in understanding.
However, there are instances where less invasive measures may not provide adequate relief.
The patient, wondering what those instances might be, listens attentively.
For individuals with severe or chronic sinus problems, particularly those caused by structural abnormalities or persistent blockages, surgical intervention may be necessary to improve sinus health and quality of life.
The patient, slightly apprehensive at the mention of surgery, wonders what types of procedures are available.
The decision to recommend surgery is not taken lightly. It's typically reserved for cases where conservative treatments have proven ineffective or where the benefits of surgery outweigh the risks.
The doctor explains that several factors influence the decision to recommend surgery, including the severity and duration of symptoms, the presence of structural abnormalities, the frequency of sinus infections, and the patient's overall health status. The patient, feeling more informed about the decision-making process, appreciates the doctor's thoughtful approach.
There are several types of surgical procedures that can address sinus issues, each designed to target specific problems.
The patient, curious about the different options, listens intently.
One common procedure is called septoplasty. Septoplasty is a surgical procedure to correct a deviated septum.
The doctor picks up a model of a deviated septum, demonstrating how the crooked wall can obstruct airflow.
During septoplasty, the surgeon repositions the septum to a straighter position, improving airflow and reducing the risk of blockages.
The doctor continues, putting down the septum model.
Another common procedure is called functional endoscopic sinus surgery, or FESS. FESS is a minimally invasive procedure that uses an endoscope, a thin, flexible tube with a camera and light, to access and visualize the sinuses.
The patient, imagining the endoscope navigating their nasal passages, listens with a mix of fascination and apprehension.
During FESS, the surgeon can remove blockages, enlarge the sinus openings, and address other structural issues that may be contributing to sinus problems.
The patient, understanding the precision and versatility of FESS, nods in appreciation.
While medications and surgery play a role in managing severe sinus issues, many individuals find relief through natural remedies.
The patient, intrigued by the prospect of harnessing nature's healing power, leans forward with anticipation.
These remedies often work in conjunction with conventional treatments, providing a holistic approach to sinus care.
The patient, eager to explore alternative options, wonders which natural remedies are most effective for sinus problems.
Some popular choices include steam inhalation, nasal irrigation, and the use of essential oils. These remedies, passed down through generations, offer a gentle and often effective way to alleviate sinus discomfort.
The doctor emphasizes that while natural remedies can be beneficial, it's essential to use them cautiously and under the guidance of a healthcare professional.
Some remedies may interact with certain medications or worsen specific medical conditions. It's always best to err on the side of caution and consult with your doctor before trying any new natural treatments.
The patient, appreciating the doctor's balanced approach, nods in agreement.
Natural remedies shouldn't be seen as a replacement for conventional medical care, but rather as a complementary approach to enhance overall sinus health.
The patient, embracing the concept of a holistic approach, feels empowered to make informed decisions about their sinus care.
One of the simplest and most effective natural remedies for sinus congestion is steam inhalation.
The doctor says, their voice filled with a soothing calmness.
Listens intently.
Steam inhalation works by adding moisture to the air, which helps to thin the mucus and open up the nasal passages.
The doctor explains that the warmth of the steam also helps to reduce inflammation and soothe irritated nasal tissues.
It's like giving your sinuses a warm hug. The moist heat penetrates deep into the nasal passages, providing relief from congestion and pressure.
The doctor then proceeds to demonstrate the proper technique for steam inhalation.
Fill a large bowl with hot water, not boiling, but hot enough to produce steam.
The patient, visualizing the process, imagines the steam rising from the bowl.
Drape a towel over your head and lean over the bowl, keeping your face a safe distance from the water.
The doctor continues, mimicking the action.
Close your eyes and inhale the steam deeply through your nose for 5 to 10 minutes. You can repeat this process several times a day, especially when you're feeling congested.
The patient, feeling a sense of relaxation just from the demonstration, makes a mental note to incorporate steam inhalation into their daily routine. Section 3. Nasal irrigation, the ancient art of neti pot cleansing.
Another effective natural remedy for sinus problems is nasal irrigation.
The doctor says, picking up a small teapot-shaped device from their desk.
What is that?
The patient, intrigued by the unusual object, examines it with curiosity.
This is called a neti pot, and it's been used for centuries to cleanse the nasal passages and relieve sinus congestion.
The doctor explains that nasal irrigation involves flushing the nasal passages with a saline solution, which helps to remove mucus, irritants, and allergens.
The Neti pot allows for a gentle and controlled flow of saline through the nasal passages, effectively rinsing away debris.
The doctor then demonstrates the proper technique for using a neti pot.
Fill the neti pot with a saline solution, using distilled or previously boiled water to ensure its sterility.
The patient, absorbing each step, imagines themselves performing the ritual.
Tilt your head to one side over a sink and gently insert the spout of the neti pot into your upper nostril.
The doctor continues.
Slowly pour the saline solution into your nostril, allowing it to flow through your nasal passages and out the other nostril.
The patient, picturing the saline solution cleansing their sinuses, listens attentively.
Repeat this process on the other side, gently blowing your nose after each irrigation.
The patient, feeling a sense of empowerment knowing they can take control of their sinus health, resolves to give nasal irrigation a try. Section 1. The Road to Recovery, a collaborative approach. As the consultation draws to a close, the patient feels a renewed sense of hope. The doctor's thorough explanations, coupled with the range of treatment options discussed, have instilled a sense of empowerment in the patient. They realize that managing sinus issues is not about finding a quick fix, but rather about adopting a proactive and multifaceted approach.
Remember, the journey to sinus relief is a collaborative one.
The patient, appreciating the doctor's partnership in their health journey, nods in agreement.
I am here to guide you, provide you with the tools and knowledge you need, and work together with you to find the best course of treatment.
The doctor stresses the importance of open communication, encouraging the patient to voice any concerns, ask questions, and share their experiences throughout the treatment process.
Your feedback is invaluable, as it allows me to tailor the treatment plan to your specific needs and ensure the best possible outcomes.
The patient, feeling heard and understood, leaves the doctor's office with a sense of optimism. They realize that managing their sinus issues is not about surrendering to discomfort, but about taking control of their health and working towards a future where they can breathe freely and enjoy life to the fullest. Section 2, Prevention, the key to long-term sinus health.
While we've discussed various treatment options for sinus issues, it's important to remember that prevention is always the best medicine.
The patient, understanding that true health lies in proactive measures, listens intently.
By making simple lifestyle changes and adopting healthy habits, you can significantly reduce your risk of developing sinus problems in the first place.
The doctor emphasizes the importance of maintaining a strong immune system, as a robust defense against infections is crucial for sinus health.
Eating a balanced diet rich in fruits, vegetables, and whole grains, getting enough sleep, managing stress, and engaging in regular exercise can all strengthen your body's natural defenses.
The doctor also highlights the importance of avoiding common sinus irritants.
If you know you're allergic to dust mites, pet dander, or pollen, take steps to minimize your exposure.
The patient, recalling their sensitivity to dust, makes a mental note to invest in dust mite covers for their bedding.
Regular hand washing is crucial to prevent the spread of germs that can lead to sinus infections.
The patient, realizing the simplicity yet effectiveness of this habit, vows to be more diligent about hand hygiene.
By making these preventive measures a part of your daily routine, you can create a protective barrier against sinus problems and enjoy long-term sinus health.
Section 3, a breath of fresh air, embracing a life free from sinus issues. As the patient steps out of the doctor's office and into the sunshine, they take a deep breath, savoring the feeling of air flowing freely through their nasal passages. The weight of their sinus issues, though not entirely gone, feels lighter, replaced by a sense of hope and empowerment. They realize that the journey to sinus relief is ongoing, but they are now equipped with the knowledge, tools, and support to navigate it successfully. The patient envisions a future where they can fully engage in activities they once took for granted, hiking in the mountains without struggling for breath, enjoying a romantic dinner without the distraction of facial pressure, and waking up each morning feeling refreshed and energized. They see themselves living a life free from the limitations of sinus issues. The patient understands that managing sinus issues is an ongoing process requiring vigilance, self-care, and open communication with their healthcare provider. But they are no longer daunted by the challenge. Instead, they are filled with a sense of determination, knowing that they have the power to take control of their sinus health and breathe freely once again. The journey to sinus relief may have its ups and downs, but with every step forward, the patient gains confidence and resilience. They are no longer a passive bystander in their health journey, but an active participant, making informed decisions and embracing a holistic approach to sinus care. And as they inhale deeply, feeling the invigorating rush of fresh air, they know that a life free from sinus issues is within their reach.